back again. As I said, we're going strong for 5 hours, so we're hour number 2. So this is Caught in the Middle, how we care for the sandwich generation. So if you are a caregiver, you know a caregiver, or you are a child with living parents, you might one day be a caregiver. Or even if if you're a person that doesn't even have kids, you can end up being a caregiver. So please share the broadcast. I don't care where you're watching from. Please share the broadcast because this is such an important topic and it is affecting so many people now that AARP is actually talking to people in like my generation, Generation X, because we're the caregivers. So it's really the whole dynamic has really changed. But I'm so excited to have back with us Ellis Dean, whom I know everyone knows because Ellis ran these Black Doctor Streets for so long. So Ellis, thank you. Welcome back.
No. I was glad to be here. Like
Yes,
I'm glad to be here and talk about this important topic today. I've been there,
yes.
so I can speak from experience.
All right. So we had a third panelist who coincidentally is actually tending to doing caregiving. So he's unable to join us tonight. So let's just jump right into it. So Ellis, you really were in the sandwich because you have children, but
Yes,
you had to take care of your dad.
yes.
Yeah. So just give us a little brief scenario of how that was.
It was very, very challenging because my children still had activities, right? My daughter's in college, so graduating. So you've got all of those activities, and she's applying for grad school. So you're trying to be supportive in that situation. My son is in high school, but so it's like all of his activities going to coaching and then to meets and games and all of that stuff. Then of course you have a job, and what made it more difficult for me is my father lived in another city. So I'm always having to be in concert with his care providers in another city. And if something goes awry, I've got to be able to pivot on a moment's notice, jump in a car or jump on a plane and get to where he is to help out. And that part is difficult. That's why in this scenario, a lot of children tend to move their parents into their home to eliminate that. Luckily, my job had enough flexibility to where I could go and on a moment's notice, and I have a partner spouse here that could kind of fill in the gap with the kids and all that other stuff. But not everybody has that kind of flexibility to be able to do that, and so that's why you get people moving them into your home or moving into their home with them, and then there's some challenges that come with that too, right? Because it's not as, it's one thing living with your parents when you're the child or they're the parent. It's another thing living with your parents when you're the parent and they're the child. Because that cliche of, once an adult, twice a child is very, very true. I mean, my father had many ailments before he passed, but much like a child, he wanted to do what he wanted to do. And nothing was going to stop him. And so, he wasn't really as willing to take help. So you almost had to trick him into to getting care and getting help. And so there's all these little things. And so we're gonna talk about it here today on some things. Hopefully we can give you some advice. And if you have some challenges, or you're dealing with caregiving, we'd love to hear your story because
please.
this
Type
is
it in
group
the
therapy.
chat.
This could be group therapy today.
It could be, really, honestly. So I, unlike Ellis, I moved
See,
in with the kids. So, and I mean, everyone kept saying, "How is it?" I'm like, "It's fine. It's fine." Oh my god.
it's not like
It was great. And then it's like, oh my God, how much longer do we have to do this? But everyone's like, I can't believe you did that. But my dad would do anything for me, so I do anything for him. And I had no people. I don't have any children. I don't have a spouse, partner, anything. So it was not a big deal for me to just pick up and go. So,
yeah.
and I think also with caregiving, And even if I wasn't a doctor, maybe I wouldn't have it all on me like this. But like just now, right now I'm in Chicago. So before I left, I had to make sure all his medication was taken care of because the first of the month is coming and his medication thing is 31 days. So since I won't be back before the first, I had to make sure all his medication was taken care of.
Mhm.
And then and that is the most stressful thing to me because my dad takes so many pills. I'm like, oh my god, and I'm just like, as a matter of fact, I almost dumped it when I was doing it, and I was like, it went like this, and it all I go, and my sister was laughing across from me because she thought it was so funny, and I was like, oh my, and I'm over here about to have a heart attack because all these pills are about to fall out. They did not fall, but it's just those things. And talking now, I'm remembering I forgot to send a message to the doctor today
Yep.
about something else because it's always something. And I don't have any children. So was this the way it was when you had kids?
Yes, it's always something. When you have children, it's always something. I think that it just feels weird when it's your parent, right? So
Mm-hmm. Mm-hmm.
there is, because the dynamic of the relationship. When it's your child, I sent both my children born, right? So there's nothing that they can do, you know, and we're basically financing their life. So it's like I got power, right?
Right.
But in that reverse scenario, even though I'm an adult now, got my own family, blah blah blah, there's still that emotional power structure
Right.
of him being a parent and you trying to pay deference and respect to their role as a parent, even though you really should have the power because I'm the one with the knowledge and the ability to make sure all this stuff is getting done and you're not doing it. So to that point, or let's, in terms of the tip that you just made, is one tip that we can give to the audience that's watching is you have to know all of the medications.
Mm-hmm.
You don't know all of those medications that your parents are taking and what they're for, you're going to be at a deficit because one, I know people that are caregiving for their parents and their parents will say, no, I took it and they're cheeking it or they're tucking it and you'll find it underneath the mattress or in the sink or in the toilet or whatever. So you have to be really clear about what medications they're taking, what they're taking it for, and to make sure that they're taking it. And so that was, you know, my father was such a private person that when he started having ailments, it would just be like, oh, he's in the hospital. I'm like, okay. And I'm like, what's in the hospital for? It's like, oh, it's for this. When he got on dialysis, didn't know what the cause for it was. And it was through, exploration, I realized, oh, it's because of high blood pressure that led to the diabetes and to the dialysis. And so,
Mm-hmm.
all right, so now, not only am I trying, okay, what high blood pressure medication he's on. He's going to dialysis. He's got these other concerns. He's had prostate cancer, but he had his prostate removed, but then that has some challenges associated with it
Mm-hmm.
as well. Then he had spinal lung cancer, so that could possibly come back. He had treatment on that, and then by the way, he had a quadruple bypass. So it was like, all right. So when I would go to the doctor with him, it was really like, what are we here for today? And how is that impacting all of the other conditions that he's being treated for?
Yeah.
And that is really, so you have to get a handle for that. So I would suggest getting a notebook.
A notebook, or if look, me, I lose paper, so everything is in my phone. I show up to the doctor and I just pull out the notes section in my phone and I say, okay, so, and I, just like as we've said here on Black Doctor, Ellis has too, we always say, please take your questions to the doctor. I do the exact same thing myself. The questions are in there, and I say, da, 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 and I tell them, oh, I say, so we needed to know this and this and this. And let me just tell you guys, unfortunately, the way that the American health system is,
Mhm.
most of them, there are a few, Kaiser Permanente, but there are a few that actually communicate all the doctors collectively,
Okay.
but most of them do not.
Right.
So therefore, you need to know all the medicines because they may not.
Right.
And if you notice, most of the doctors, when you go in, they're going to ask you what they are because they don't know. They know what they prescribe, but they don't know what the others have prescribed. So it's
Mhm.
really important. And then that's why, you make sure you know which doctor you're there for and you have the right questions for that doctor. My dad has two neurologists. I'm like, okay,
Mhm.
so wait. Now, which one are you? One's for stroke and one's for seizure. I'm just like, it
Mhm.
is just, it's a lot, but you have to keep track of it. So whatever way works for you, if it's a notebook, if it's your phone, whatever, but make sure you keep track of that information. And if you have questions, there's these lovely patient portals. I think that's the best thing that they have ever invented, because you do not have to wait until you show up to the doctor to ask the question. Type it in the patient portal. More than likely, you get an answer probably within less than a week, probably much faster than that. So type it in the patient portal if you have
Yes,
a
and
question.
you can monitor a lot of things through that patient portal.
Yes.
You can read the doctor's notes after, because your perception of that visit might be a little bit different than the doctor's perception of that visit. So you can read the notes and get some insights there. The second tip I would say is make sure your parents taking the medication as prescribed. And we just talked about that because,
Yep.
especially if they're experiencing pain, they may overdo pain medication, and that could become problematic. Um, if it's not working, then you go back to the doctor and get it up. But don't let them take more than what is prescribed, because that can be, especially if they're taking like an opiate or something
Yeah.
like that, it could really be problematic. So that's the second tip. Number one, know what they are, what they're for, and then number two, make sure they're taking them as they're prescribed. And so,
And that's important too, also because some medications you need to take with food, some
mhm,
medications you don't. If you don't take it with food, you have horrible reactions, because you took it on empty stomach, and now your parent is sick and you don't know what's going on. It's because the medicine was given at the wrong time. Also, the other important thing with time is a lot, especially medications that deal with blood pressure.
mhm,
So some people need their blood pressure raised, some people need it lowered, depending on what time you take the medication. If you take it at the wrong time, you might do the wrong thing, and then their blood pressure drops, they pass out on their way to bed or something.
yep,
So, I mean, these are real things that can happen. So it's really, really important that you know exactly when they are supposed to take the medications and give it to
mhm,
them at the exact right time, and that they take it when they're supposed to take it. You do not want them to OD. So if medicine was supposed to be given at noon and you miss noon, make sure it's okay to miss noon, because if it's missed, don't give it at 4 and then give at 5 o'clock the evening meds.
right.
So, because you never know how those things will react. Sometimes if you give medications too close together, then basically it's like an overdose, and now the patient's acting really strange, and you're trying to figure out, why is your parent not talking, or why are they lethargic? It's because
Yep.
basically they've OD'd.
Yes, particularly if they're on any of those medications that are for mental health, like
Hmm.
depression, anxiety, things
Yep.
like that. A lot of those can make you lethargic. They can make you gain weight. Um, so there's a lot of this kind of side effects, and that's why tip three was know any potential side effects of the medications, because if it's something that could potentially get them to cause them to gain weight, then you have to make a dietary change, right, while
Yep.
they're on that medication, or they have to exercise more while they're on that medication, so they don't have to gain weight and have those effects, right? Because when we start getting to obesity, because we've gained weight because of medication, now we can create more problems for them health wise,
Right.
while they're trying to get their mental health under control. So there's this so I promise you, and there's another caveat to all of this, right? So you said earlier that you have a great relationship with your dad. You know, he would do anything for you. You'll do anything for him. No problem. Drop everything. I'm moving back home. What if you don't?
Right.
Right. And so my father and I had a strained relationship, and it was, the act of caregiving was both awkward and cathartic for me. And what I mean by that is, like, it was awkward because didn't have a lot of those father son moments, those things that you do. I don't have those type of memories of him. So to go in, it's like almost, it was almost like it's like a stranger that it's like an acquaintance. Like, it's
Hmm.
now I've got to try to change your diaper. And literally, the last time I was there. He unfortunately he passed in December. Um, the last time I was there, I literally had to pick him up because he couldn't walk, and the only thing he had in the apartment was a walker, and he needed to get to the hospital, and he did not. Again, that stubbornness, because we had sent Life Alert
Right.
a couple of times to go pick him up and take him to the hospital. He sent them away. He convinced them
Oh, Lord.
that he was fine. And that's where the challenge comes, right? Because physically he's not, but mentally he was. He was sharp. So he was able to convince the ambulance driver, Life Alert people, no, I'm fine. I'm good. I can do this. I can do that, whatever. And they just left. And literally he was sitting on his couch for a few days and had not moved. Couldn't even get to the bathroom. So he had a diaper on and he wasn't eating because he couldn't get up. He's just sitting there on the couch. So I literally had to pick him up and carry him. And he lived on the third floor. And carry him to an elevator and then ride the elevator with him in my arms down to load him into my car to get him. And I had to convince him, hey, will you let me take you? Since you didn't want Life Alert, and I should have had them come and follow them.
Right.
He wasn't willing to do that. Well, I'm going to have to pick you up. And he was like, okay. He was willing for that. So I had to pick him up. And that's so the cathartic part of that was it was me realizing I had to let go of the past and focus on the present. And the present was about getting him the care that he needed. And so I was able to kind of move beyond whatever the petty stuff that was happening in the past, and give him grace, and because kids don't come with the owner's manual. I look for mine with my two kids, and they don't come. And so you really have to wing it. And then when if you don't have the best example as a father, and then you think about the times, this was the early 70s, early mid 70s, things were parenting was a lot different then than it is now. And so I give him grace, for that. And I said, okay, like they tell you in church, the way you break a generational curse is not to repeat the same mistakes. And so I think I've made some a good job in terms of with my children, trying to give them things that or be the dad that I did not have. So
yeah, my father is the same way. He and his brothers. I think Neil will probably watch this, but he and his brothers are the best dads on the planet. But I don't believe they had the best example. But oh my God, hands down. Like going through all this with my dad, my uncle, they call my dad very regularly because my dad's oldest. They call their big brother all the time, checking on him, and they check on us, and they've come to visit as well to help us out. And so they and I call them and I tell them, I'm like, this is awful and this is hard. And because they've come and they've seen it, they know how hard it is. Because my dad has moments and Jesus Lord. We're like, Dad, I'm like, Daddy, it's me. It's your daughter. Please. And you say picking up your father. My father, God bless him, is he weighs more than I do. And I'm like, how am I gonna lift this man? But when he goes down,
yes,
he gotta get up. And I'm like, oh.
Well, and let me tell y'all, dead weight is different than live weight. Okay. So my father, at that time when I picked him up, he was probably about 85 pounds, which is not a lot. Like when I go to the gym, I bench press more than that. So I'm like, okay, that's why I looked at him. I was like, oh, he doesn't weigh that much. I can scoop him up. No. When I say dead weight, it's zero help.
Zero.
Like when somebody tries to pick you up, you give them some help. Like you use your muscles, and so it doesn't. You kind of help them balance that weight. None. And so everything was above the waist that where his weight was. So it was off balance and awkward. And then if we started moving, if I started tilting, he couldn't help me. Right? He couldn't help me.
Right.
He was all on my arms and my chest and my legs, and literally when I got him in the car, I had to pause for like 2 minutes.
A moment. Yeah.
I had to get my body back. And it was like, just think about straining your muscles as hard as they can go for 3 to 5 minutes,
Yeah.
and not being able to stop with the 85 pounds weight. And it was definitely difficult. So I think you're bringing up some really good points in terms of you building that relationship, right? And then your next step is you have to learn, and
Right.
learning about their conditions, learning about treatments. Um, Parents, and I have some friends that are dealing with this now. Parents with dementia, right? So
So I was going to talk about that particularly because I'm sure many of us watched the Wendy Williams documentary this weekend, and that was the saddest thing to watch just because I have known about Wendy Williams for so long because my family, we have family in New York. So
right.
I would always listen to Wendy when I was there. I've met Wendy Williams. I've been to the Wendy Williams show. And it was so sad to see. But what really disturbed me, and I think that we might have to do a show about it on Black Doctor, is the fact that whatever that crazy law is about the guardians in New York, something is wrong with that law.
Mm,
Because her sister is an attorney and you would not let her be the guardian?
wow.
That doesn't make sense. That makes zero sense. It's her older sister. She is obviously a capable person. She has a family of her own. Like I said, she is an attorney, and you wouldn't let her be the guardian. So who's this strange person that's the guardian that doesn't communicate with the family? So they have no idea what's going on. And it is. And I saw somebody make a comment about Wendy gives as good as she takes. The way that she's treating the people. If you watch the documentary, and I was like, that woman so clearly has dementia. She doesn't even realize what she's saying to those people at that moment. She might realize it later, but she doesn't realize it right in that moment that that's what she said to them and that she was so mean. So I think that, and that's dementia. That's just what it looks like.
Mm-hmm.
So figure out the guardian laws, please, in your state, and make sure that you have a plan. That's, we always talk about the money, right? We always talk about make sure you have a will and, you have a trust and all of this stuff, but make sure that you have something written down on who can take care of you, because my God, these guardians that they pay these people. These are complete strangers that they pay.
Right.
They don't have your best interest at heart, I hate to say.
No, they don't. And that was one of the things I had to do because my father, when he first started, his health first started going down, he had for lack of a better term, a partner, right? And she was taking him to his appointments, and she was listed as the decision maker.
Right.
Well, they split, but she's still listed as a decision maker on his medical records. So, and on his the person that can make decisions about if they're incapacitated.
Right.
So when he gets in the hospital, they're like, "Well, we've got you can't make any decisions," and I'm like, "Wait, what?" And they were basically, so I had to work with the social worker at the hospital to get that power back. And if you've got siblings, it becomes even more problematic. Just as in Florida, that Wendy Williams situation is a whole nother thing, but it's in Florida because I have two sisters. At least two of us had to agree that I was going to be the one. So I had to get one of them on the phone to tell they're like, they're doing it in writing, had to be on the phone. They had to hear the person say, yes, my brother Ellis is the one that I'm in charge to. And so those are that guardianship situation.
Power of attorney, guardianship. Yep.
Power of attorney. And then it was.
Oh, and the medical proxy.
Yeah. So those three things you're going to have to learn about. You're also going to learn 3 letters. Unfortunately, at some point,
yep.
They're going to ask you about DNR, right? And I didn't know what that was. But I'm getting a call from a doctor saying, yeah, we're trying to put him on a DNR list. And that's what I get mad at healthcare, because y'all get used to medical terminology and jargon. When you're calling somebody that I think I was on my way back to Atlanta from just having dropped them off, and he's like, yeah, we want to put him on a DNR list. Well, and I had to kind of think, and I had to go back to my black
doctor hat.
And I was like, Oh, and DNR, just for those watching, means do not resuscitate. So that's basically saying that it's their
If heart
condition.
stops,
If their heart stops or if they stop breathing, do you want them to go into
CPR and ventilator, all of that stuff.
all
Life
that?
saving measures is what it is. Yeah.
Exactly. And so when they call and say we want to put them on a DNR list, that's them protecting them, not you.
Hmm.
Okay.
Yeah.
So because they're saying, because he was like, well, if we start chest compressions, you might crack a rib. You know,
Right. Because he's so, yeah.
he was so frail at that point, and so blah blah blah. So they're thinking, okay, then now we've got potential, lawsuit.
Hmm.
They put him on the list, and they say, hey, that's the family's wishes. It protects the hospital, and then but that puts you in a situation where you're thinking about, wow, and that's a decision that you don't want to have to make.
Mm-mm. Mm-mm.
And like at some point you might have to, but it's not. It wasn't a pleasant decision
Right.
to have to make, and so yeah, we need to be proactive about. Yes, Karen, you're absolutely right. That's great. That's a great point there,
Yep.
Karen. And we'll put that as another tip. Know your parents' finances.
Yep.
That was the one thing I was happy about. My father was meticulous about his finances,
Oh, good.
even though he didn't tell us about it. We found out a lot. we knew he was always miserly, and we knew he'd saved a lot of money, so that part. But some people die with debt.
Hmm.
That debt does not evaporate when you
No,
pass.
it doesn't.
It goes on to the surviving family members, and so your parent may have passed and then left you with thousands of dollars in debt. That it's going to
Most
pass,
people want their money.
and they want their money from you, and you didn't sign for it. You didn't have to sign for anything. You didn't sign for the house, that car,
You
whatever.
didn't receive it, you ain't getting nothing.
You get any of the benefits from it, but now you're going to be obligated to pay that. And that's just lobbying. That's that's all of that happens in Washington with our lawmakers, and they've got it to where that debt passes on. And so I would say thank you to him for that. That we did not have to deal with all of that rigmarole.
Yeah.
But if you do have some assets, I would suggest you got a parent with some assets. A living trust is the route. You can have a will, but will has to go through probate, which I learned the hard way. He had a will,
Possibly.
and that could be costly because they have to file it in the court, and then you have to wait 90 days. So any execution of that will doesn't start until you file it in court for probate court, and then in the state of Florida, which is where he was, there's a 90-day wait period because you have to let all the creditors know, hey, is there any debt out there? So they give them 90 days to make any claims on any assets that they may have, and so you have to wait. We have to wait for that, and then now you don't have to worry about the taxes unless it gets into millions in terms of inheritance taxes. That's in millions. I learned that from the attorney. But you do have to have the ability to afford an attorney to file that probate to get that. Yeah, make sure you have to have your death certificate. You have to have that and get multiple copies of that because if they have insurance, they're going to want that. If they had a cell phone, they wouldn't. Even though my sister was on the cell phone listed, since he was the one that opened the account, we had to show a death certificate in order for them to cancel the cell phone account. So those are little things that you have to do. So I
Yeah.
would so roll their assets before, especially dementia, early signs of dementia. Get them to put their assets in a trust and then have you listed. So even when they pass, that will move on to you, and it'll allow you to be able to distribute the way if they have a will, that's fine, but you would have the ability to distribute those assets or they can just write down and you just have
Mhm.
it where you don't file the will, but you just have it where it's written out what they want done with the assets, and then you just execute it as they saw fit. So,
Yeah.
I learned this after the fact.
And then, what I learned, if your parent is a vet, there are so many amazing services that the VA is going to offer for free.
Yes.
This may take you a minute to get registered, but you need to keep knocking on that door and keep bothering them because they served. My dad served 4 years,
Mm-hmm.
and I don't know that that's a lot or a little. To me, one day is too much, but one day it would be a whole lot for me. So he served 4 years, and I will say the VA is, once we got enrolled, they have really been very helpful. So we actually have caregivers that come and help us with him five
Mhm.
days a week for 20 hours a week, and that is solely because of the VA.
Yep.
So if you have a vet, then please, while they are fine and perfectly, everything's great, register for the VA now. Don't wait till they get sick. Register now, because they only have to go to the VA doctor once a year. So you can still go to your regular doctors. They just have to go to the VA doctor once a year to stay registered. But there's so many services that will be very, very beneficial to you if something does happen later down the line. But even, before anything happens, there's so many amazing things that they can utilize because of the VA. I mean,
Also, there's also death benefits that come because my father also served. He served in Vietnam. So there's death benefits that come with that, up to and including burial. And
mm-hmm,
so if you, because funerals are expensive, that's a whole nother topic.
yep,
We'll get to that later in the program. But yeah, so there's a death benefit up to and including burial. So if they, so my father had the option to be buried in at Fort Jackson there in Columbia, South Carolina, where he's from Orangeburg, which that's just a small city, maybe about 30, 40 minutes away from Columbia. He could have been buried at Fort Jackson at no charge, and they would have the headstone and all of that stuff on there. And so that would have helped alleviate a lot of costs that are associated with funerals. Luckily, my family already had a plot that was purchased there for family in Orangeburg, so we were able to use a family plot. Um, and just coffins are outrageous. I mean, they are.
which is why my mother has said a million. My mother's a priest, so she, obviously she's done a lot of funerals. She's like, cremation is the way to go. Because they are very expensive. So please, if your parent is a vet, please, like I said, get them registered today. Don't wait until something happens. Just get them registered now. They will. I mean, wheelchairs, walkers.
Yes.
They came and outfitted the bathroom so that it was safe for him. I mean, literally, just it is crazy how much you can get from the VA. So please, please, please register with the VA.
And then at the as part of the death benefit, they will have they can come and do the gun salute
Oh
at
yeah.
at the funeral, and they will give a flag to drape over the coffin, and they'll do the folding. They'll do the whole ceremony if you want them to engage in that ceremony as part of their veteran benefits. And Social Security, as a Social Security Administration as well. There are some now. It's not a windfall, but there are some funds that you can access from the Social Security Administration. Again, it's government, it's red tape. So there's a lot of foolishness you have to go through. Um, but yes, I would say, and to Karen point, thank you for staying with us. You have to be proactive and do it sooner rather than later. So it's not like
Exactly.
they said, look, if they are a veteran of any amount of time, access that veteran benefit. And then talk
And if
about
you have to, because even my dad, we couldn't find the discharge papers. So then you just have to do a little research online. We lived in the state of Michigan, so we went to the county where we live, and actually the county office had his discharge papers and gave us a copy. So please, if that don't let that be a barrier. Everything can be found. You just
yes.
have to go find it. That's it. Just go find it. And then, yes, the paperwork can be very thick. It was a lot of paperwork for the VA. It is well worth it in the end to just do it. Please, just do it. Do it sooner rather than later.
When you're caring for your parent, particularly for what you're doing, having to move there, it's a part-time job. Like you have to dedicate hours, you know, either daily or weekly to handling all of this information. Have you a binder, a notebook, something where you have it all written down and have it, if it's got the dividers in it, this could be your VA stuff. This could
Yep.
be to where it's organized for you and it makes sense. So when people ask you, you just flip to it and you could have all of that. And so because, doing it after the fact. So we're trying to find all this information out after he, passed, and we're working through all of this stuff while trying to plan a funeral. And you need that death benefit because the funeral is happening. And yes,
Make their money.
there's a nice funeral director. And I learned every time I would make a joke with my sisters that every time the funeral director said, "Oh, we'll take care of that for you," that's a charge.
Money. Mm-hmm.
That's a charge. So he was so accommodating. I'm like, we get charged for this. Like it's not coming out of just his kindness of his heart. We get charged every time he says, "We'll take care of that for you, Mr. Dean. You don't have to worry about that." "Oh, we'll take care of the death certificate for you. Don't worry about that." There's a charge for that, and you have to. And then what my sisters did like, and my wife didn't like this part, but I was like, it's a business. You're there for the funeral, day of the funeral. Before you even go see the body, we had to go settle up.
It's a business. I mean, you can't be mad at the man. It's a business. This is how you take care of his family.
Walked into the business office and he said, "Oh, here's everything that we got." And he had a nice long itemized. This is what, and had the big number at the bottom. And thankfully, because we were able to show that he had a death benefit as part of his insurance, he's like, "Okay, we will defer that because I know it's going to come out of the insurance." And so we didn't have to put any out of pocket, except for some early stuff, any out of pocket costs. So that helped that my father was smart enough, but not everybody has that. And so,
well, we know not everybody has that because we see how many GoFundMe's for funerals pop up. It's not funny, but it's awful. And please, even at the ripe old age of 47, I have a policy on myself. So if something happens, although I think my mom has one on me too, but if something happens, I wouldn't. You don't want to burden people, and funerals are very expensive.
Oh my gosh, we got the
business. I'm telling you,
we got the I mean, there were coffins that were up to like $40,000.
Mm-hmm.
And I was like, "Wait, what?" We got a nice one, but it was pretty basic. But even in the basic one, it was still had this mechanism to where it could raise and lower the body. So when the body was for viewing, it was raised up, and then when it came time to close
it went down.
You just hit this button, and I just saw my father getting lowered, and then I was like, "Did we pay for that?" Like I thought we got the But those are the things that are really right, Karen. Right, deeds, insurance policies, utility bills, credit cards, bank accounts, car titles. Any loan paperwork, if they're still living in a home that they're paying for, that's another thing, right? Because we're in the generation, they're in the generation. My parents paid off the home that I grew up in, and then they sold it, and he was living in an apartment, and luckily the timing was right. It was about time for him to renew his lease, so the apartment was like, "Don't worry about it, you got till this amount of time to clear out the apartment where there's nothing else owed." So that was another burden that was lifted. But you have to think about all of those things, because if there's a loan on the house, if there's a lien on the house, that's going to fall on you as the caregiver or as the child or the children.
Yeah.
So.
And then I just read this quote literally today. Even if your parent is in a facility, you're still a caregiver. And that is absolutely true. My father was 6 weeks in a facility because he had shoulder surgery. And me and my mother and sister were there every day.
Yes.
Because if we weren't there, things wouldn't happen. Like my dad would tell them he didn't need physical therapy, knowing good and, well, he needed it. But he'd say, "No, he's not doing that today. That's why we're there." "Yes, you are." And then, so, they would give him a shower. I think it was once a week. He would say, "No." We're like, "Yes, you will." Just So there was reasons you have to be there. Thankfully, this place was phenomenal. It was a really excellent facility. My
Right.
dad has been in one, two, three, four facilities, and this there was two that were top notch, and this was one of the two. Um, the other two, one it was COVID. I'm going to give them a little grace because it was COVID, but
Right.
that's all the grace I can give them. Like this much, you can't see it because it was awful. It was awful. The man is post stroke, and you're not dressing him. He's confused. He doesn't know what time of day it is. Well, he's in his pajamas, and it's 5 o'clock, and he never got in his clothes today. Why is he confused? Well, I don't know.
And it's every and I found that every nurse was different, right?
Right,
So even like I would come in, I'm like, ooh, I got the good nurse today, right? And
right,
so, and they would like, oh, Mr. Dean, and they were, joy. Even when he would soil himself, they'd be like, oh, Mr. Ellis, would you just mind stepping outside? I'm gonna take him, clean him up, and they had no problem with it. And they would just, and I was like, ooh, they are better than me. And
right.
you get that one that they knew he soiled himself, and their shift was about to end. They weren't going in there.
Oh,
They weren't going in there. And you like now you got to sit there with in feces or in
right.
urine because
Until the shift change.
until the shift change and then they got to come in and then they make the change and so it really is. So Dr. Renee is speaking truth. You have to be present um, in order to get the most out of them, and it's unfortunate that that's the way it is. But you do have to have a presence, and it wasn't until I started showing up there in the hospital, and I was like, I'll be back in a couple of days. So, and I would
Yeah.
call and say, hey, this
You
is
got to call, you got to visit, you got to, like when it was COVID and we couldn't go, we called 3 times a day to the hospital. My mother called in the morning, me and her called in the afternoon, and then me and my sister and her called in the evening, and then we might have one of his brothers on the phone with us too in the evening. But we called 3 times a day because we he was post stroke. Our man was confused and it wasn't helping because he couldn't tell us what was going on. So then we had to rely on them. And oh my Jesus, I love my colleagues, but we had one doctor that she knew she couldn't speak to me ever. She couldn't speak to us again because she had said my dad was basically dying. This was in 2020. The man is quite alive and well.
right.
And so I was like, but I just talked to him. What is she talking about? She said because he was sleeping all the time. I said, well, let's see. He's in a hospital. He doesn't even know where he's at. He has not seen not one human being that looks familiar. Probably ain't seen none that look like him either.
Right.
He's a foreigner. And so you tell me, what does he have to stay awake for? Your food's not good, because my dad does like to eat, but the food's not great. So I'd sleep a lot too, because I need to wake up from this nightmare. Let me go back to sleep. You know what I mean? And so I told whomever and was like, could you just make sure? Well, I told them, one, don't call my mother again because you're going to make her sick. And I can't have 2 sick parents that I can't get to because at
Right.
that point I couldn't get home. So I can't have 2. So don't call her again. If you're going to call somebody and say something crazy like that, call me because I can handle it a little better than her. And we never heard from her again. Thank the Lord. Because when I tell you, I was about to go up to the hospital and have a word with that doctor because I was like, how
No,
do you think this was a good idea?
you don't know. And I like this comment by Karen. She's like never get into a pattern of visiting. You have to militarize your interactions and flank them. Right, because it's almost like it's like gambling. If you're a pattern, they go, oh, it's 3 o'clock. They're gonna call it. So
Right.
they're gonna be here at 4 o'clock. But if you're a random when you visit, sometime in the morning, sometime in the
Yeah.
afternoon, you're gonna have to be on their P's and Q's all the time because they never know when you're gonna show up.
Oh, we
So
used to be sitting there the whole time, so you had no choice but to act right because we were always posted up. I'd have my laptop sit
yeah,
there, and I'd do my show. So
right.
I'd do my
They're
meeting.
walking around. Hey, how you doing? Yeah. So the other thing is, I realized, and I worked at Black Doctor for 3 years. I worked with a countless. I don't know. Can you tell me how many doctors I worked with over that 3 years? Multiple specialties. Great at giving advice. When you start getting into the end user, when I took my father to the emergency room after carrying him to my car, we went to a dialysis facility first, and they were like, "No, we need to make sure he's medically cleared since he hasn't been to dialysis in a couple of weeks. Take him to the emergency room." So I had to put him back in the car, take him to the emergency room. Now, the emergency room, we sat in the emergency room for 6 hours before we were seen. I had the time. He had the time. 6 hours before we were seen, and then finally got him in the back. And you wait for the doctor, and they come, and then they do the assessment, the triage, and the doctor comes in. And then they said, "Oh yeah, okay, we're going to keep him here overnight." Fine. So I leave. To hey, I've been there. I had eaten. All I had was a Snicker bar and a bag of chips. I'm hungry. I've been in the hospital all day long dealing with all of it. So I said, I'm gonna go get me a good meal. He's gonna be in dialysis. I said, how long is it gonna be? Oh, about 2 hours. Cool. Then no, they first said we're gonna do dialysis and then you can take him home. All right, cool. 2 hours. I'll be back in a couple hours. Then I get back there. They said, oh, we're gonna admit him because we couldn't finish the dialysis. So I had to go find him on the floor that they admitted him to. Um, and it was everything kept changing. It just depends on who the doctor was on that floor, and I had to stay on top of that. Okay, well, what's the new plan? Here's my information. Well, okay, well, why is this? What and you have to. That's when you have to know about the conditions and know about what's going on because they'll tell you anything, right? And they could be absolutely right, but you don't know if you don't know. They could be absolutely wrong. So Dr. Renee News is like, he's not near death. What are you talking about, right? So now you can give them some pushback. But if they just said that and she didn't know, they could have stopped services and would have put him on the pathway to dying just because they didn't want to do any work. And so you really have to familiarize yourself, and that's why we've been such at Black Doctor. The Black Doctor is such a big proponent of giving you current culturally relevant health and wellness information, because the more you know about your health, the more you can learn about your parents' health, the better equipped you are.
Quickly recognize when things like they lost my dad's clothes. Now I don't know how you lose this man's clothes, but obviously he was in the hospital for 10 days. He started to get very burly and look like he was homeless, but he clearly didn't come in there looking like that. But they lost his clothes like he was some homeless man. And of course, COVID, so he had no visitors, but no one had visitors. So I don't understand. But yes, the man went to the rehab literally in a nightgown because they had lost his clothes. And so this was a neighborhood that doesn't have a high population of Black doctors nor Black patients. And so I felt like, and actually, I don't think he saw a Black doctor the whole time he was there. So I felt like this is probably those unconscious biases, and I didn't, and so I was hyper alert on it because I knew. And so we really did end up talking to like the highest of the doctors of the hospital because I'm me. And I was like, no, this is not going to go. And if he's going to keep going here because it's close to the house, then we're going to have to figure something out here, because you can't treat people like this. You're not going to treat my father like this. So
there's an article that just got printed in Fierce Healthcare that I just posted on my LinkedIn page today that talked about, and this is a survey of healthcare workers, and they said they have witnessed or understand that there's still discrimination, and that discrimination for patients of color, of patients of color in healthcare. And that discrimination could come from not getting the best treatment, not getting prescribed the best medication, getting just a lot of stereotypes get applied to patients. And it says not only are they witnessing or they know it's existing, but it's causing them stress if they were a caregiver, a nurse, doctor of color, because they know that patients of color come in, they're probably going to get some disparate care. And so you have to be, and that's in 2024.
Right.
They just did the survey they got the results earlier this month. So what you're doing, I'm applauding you, and I wish there could be more Dr. Renee's in their families to go out there and fight that fight, because it's sad that you have to fight it. I became clever enough that when I would talk to a nurse or talk to a doctor, I would drop a couple of phrases and a couple of things.
So they would know that you know what you're talking about.
And then I would see their face change. Oh, okay. And then they would start having real conversations with me. And they're like, okay, cool. Now it's not this. Don't give me the surface stuff. All right, no. What
and my dad, he would sometimes I'd come in the hospital when we finally could see him in the hospital. I'd come in and he'd say, "Oh, that's my daughter. She's a doctor." And they're like, "What?"
Right.
And so then they're like, "Oh, Okay,
That's your act right card. That's basically like you need to act right, 'cause, you know.
exactly. So, it's just really, it is, it's not a fun thing to do, but you have to keep it together. And if you have somebody who's in and out of the hospital, you have to keep track of all those hospitalizations and what happened while they were there, because when you get to the next doctor's appointment, they're going to ask you. So you need to make sure you know what procedures the person has had, when
Mhm.
they had them. And like, a lot of this stuff you can find out from those patient portals, because a lot of that it's there. Thank the Lord. Yeah, a lot of it's there. The test results, any seat procedures, all of that stuff is pretty much usually on those portals. So you should have that as a cheat sheet, but you got to keep track of all of that information. And really, you have to be the advocate. And I say that for everybody. It doesn't matter if it's you're caregiving or not. If a friend needs you to go to the doctor with them and they're going to find out something bad news, probably that's why you needed to go with them, then you need to be the advocate and you need to be the one paying attention, because they are too busy crying or whatever and can't pay attention, or they're in shell shock and can't hear anything because they're in such shock. So you got to pay attention. You have to get that information for them.
Just
So,
to give you all some of the statistics, it says Dr. Google says over 65 million people, 29% of the U.S. population, give care to chronically ill, disabled, or elderly family members or friends. 29% of the population is dealing with what you're dealing with right now. So if you're dealing with it, so you're not alone. I'd say they provide an estimated 20 hours a week of care. On average, adult children giving care to aging parents are women around the age of 49.
well, I'm 47. So, but another thing is, please make certain that you take care of yourself, because guess what? The very first day we had this training on Zoom for taking care of my dad, and what first day they said the caregiver dies first, and they said they die from dementia, and they said they die from dementia because of high blood pressure. So if you didn't hear anything else we said today,
Take care of
please take care of yourself so that you do not get high blood pressure, because high blood pressure can lead to dementia.
Yes.
And there's all sorts of diseases that fall under the umbrella of dementia, which we probably will end up talking about in chronic conditions next hour. But please know that you've got to take care of yourself, because you can't take care of anyone else if you don't take care of yourself. And
And
God forbid you have to be a caregiver, you can't be sick too.
exactly. So you can go to the Like Doctor.org YouTube page. We did a whole series on dementia with Cedar Sinai. I think we did a 6-part series on dementia, so you can look that up. Alzheimer's is a form of dementia. It's not the other way around.
Right.
Alzheimer's is a form of dementia, and it's the most common type, and it is disproportionately impacting people
Like,
of
yep.
who are less likely to seek treatment and care for Alzheimer's and that. And so please do that. I will say socially. So we just talked about all the health stuff for most of this hour, and I know we're going to be wrapping up because it's a full
Yeah.
day of shows. Socially, that's going to be, if not the hardest part, it's going to be as equal as dealing with them medically, because my dad wanted to do what he wanted to do, and that led to a lot of the exacerbations of some of his health conditions. And what do I mean by that? My dad liked to get a little taste. Y'all know what I'm talking about. And so he was still drinking while he was going through treatment. And when he would be in the hospital, of course, he can't get any alcohol, but he's calling his friend from the bar to sneak him in alcohol. This is what you have to deal with. And then he becomes non compliant when he gets discharged, because he wants to go back and hang out with his friends at the bar and not go to his doctor's appointment and not go to this and that. And so when you're not go, so that's why his ability to walk go with further and further down, because they brought a machine to exercise his legs. They put him in a walker, but at that point, his legs weren't even strong enough. His arms weren't even strong enough to even use a walker. He had to be in a wheelchair. But somehow he was finding the strength to walk to the car. I'm like, why are you driving, Jesus? I'm like, and like, so he got into a car accident, not a major one, but he had gotten into a car accident, and then because he was just doing his pattern of apartment, bar, whatever, he would go to his dialysis 3 times a week, but he wasn't even going to the DMV to get his plates renewed. His plate was like 2 years past due, so he could get pulled over at any time. He had got
A black man in Florida. I don't care how old he is. That's dangerous.
that's dangerous. So he didn't have his plates renewed. He didn't have his driver's license renewed, but he's still out there driving. He was like children just following the pattern of what he had done, and even though his health was deteriorating, he couldn't get out of that pattern. And that pattern. So you've got to help your parents break some of those habits, and that's the hardest thing to do. I had to get my mother there with her because she has high blood pressure, and I had to kind of go down the laundry list of things. Mom, you can't just keep having your stress and anxiety going up. That's driving your blood pressure up, and now you're on 3 different blood pressure medications. That can't be good. So you've got to get them to break some of those habits, and that's the hard thing to do because they've been established these patterns for like 20, 30, sometimes 40, 50 years. These habits have been ingrained in them. And now you're trying to get them to break them in order to preserve their life, and they may not quite get it. So that's a social challenge that you have to do.
And here's a free tip. I was like, you have to keep your blood pressure down. We just heard the lady said, right? The caregiver, the high blood pressure dementia, right? Walk. It's free.
Yes.
Walk. 30 minutes a day. You don't even have to do 30 consecutive. You can do 3 10-minute blocks. Walk. 30 minutes a day. It will help with your stress levels, and taking care of anybody, children, parents, grandparents, whomever, is stressful. Working your job might be stressful. Walk. It will lower your stress levels and help you with your blood pressure. And you might go to the doctor and they say you can get off of your medication. My dad, he'd started going to the gym and he was so excited. Now, had I told him this, of course I told him this, I'm a doctor, but he went to the gym and all of a sudden he could get out his medicine. They kept lowering the dosage. And I said, Dad, isn't it something? He's like, yeah, I can't believe it. I had been saying this for a long time, but I was so glad that he was going to the gym and that his medicine was coming down that I was like, we're okay, But yeah, please take care of yourselves because you have to in order to take care of others. I have a 30% tear in my rotator cuff because I take such good care of my dad. But I also recognized that my arm was not acting right and was like, we got to do something about this. So I had to go to physical therapy alongside with him. So he was on the other side having his physical therapy and I'm on this side having mine. Because I was like, what we can't do is, one, I can't afford to have rotator cuff surgery right now because who's going to help take care of him? And so I didn't have to have surgery, and I had 1 cortisone shot, and I haven't had to have, and that was in 2022. So the therapy helped, and me and the trainer, we kept working out and strengthening the muscles around it. So I'm good. But thank you, Ellis.
Take care of yourself. Take care of yourself, please. Yeah. The best thing you can do for your health is focus on dropping 10 pounds. 5 to 10 pounds, you will see your blood pressure will be better, your blood sugar will be better, all of that will be better. Focus on that, and then the rest.
Yep. Drink water and walk.
Water. Yes.
Water and walk. Thank you so much, Ellis. And I will see you guys the next one. We're talking about chronic conditions. We have 3, I think, amazing doctors. So I will see you then.
I'm watching that.